All right, guys, we can go ahead and get started. So I can start by introducing myself. My name is Natalie Mullen. I am a senior here at Kansas State University. I'm double majoring in biology and Spanish. I'm also president of the WellCat Ambassadors organization here on campus. So the WellCat Ambassadors just work hand in hand with Lafine Health Center and educate college students about all things health and well-being. So here with us today, we have Dr. Norman. He is the Secretary of Health for the state of Kansas. And he's here to give us some information about the COVID-19 pandemic and how that relates to college students. So welcome, Dr. Norman. We are so excited to have you here with us today.
Hi, Natalie. Thanks for the invitation. Happy to be here.
Great. Okay, so we can jump right in. So the first question that I have for you is, what advice do you give for college students now regarding the COVID-19 pandemic?
Yeah, that's a real good question, Natalie. And I know you and your colleagues are thinking a lot about it, or you wouldn't have called me in the first place. But I think that one of the first things that you have to do, and as students, and I don't mean just you, but your fellow students all over the country, are to, one, believe that it's a serious problem. Because I think one of the things that has kind of gotten by a lot of people, just judging from how it's been going on the campuses as people come back, is that I don't really think they're taking it seriously. And I know that forever young people typically feel like they're kind of invincible and can't be harmed by something like this. But hopefully people are coming around, they're reading information, seeing videos and things of where people are becoming infected, and then finding where young people have gotten infected. So I think the first thing is to really reckon with the fact that it's a serious problem that we need to contain. Otherwise, you might end up having to have a gap year, which is something that nobody really wants to do besides having an infection. So, and I have ideas we could talk about as to things you can do that I think are practical, and you could still have a good life despite it.
Great. Yeah. So speaking of that, we all know that being social is a big part of college life. How do you recommend that college students still have a social life during the pandemic?
Yeah, I think that's a real practical question. And the way I think about it is kind of a continuum. You don't want to go into complete lockdown on this end and have no social life. I don't want that, and I'm, not a college student. So you don't want to be all the way down here, nor on the other end of the extreme do you want to have absolutely unrestrained social activities that put you at high risk. So I think one of the things that's important is to say there's a continuum someplace between lockdown and unrestrained activities. And I think one of the things that would be ideal is if you and colleagues, student leaders, community leaders, the administration, Greek house leaders, et cetera, could get together and say, and just have a little reality session that says, we have to do something that protects us. Bring in some public health experts that are local, for example, and say, what are the practical things that we can do that maybe we're not all the way out here on the continuum of unrestrained social activity. We back it off a little bit, smaller groups, more outdoor activities, and the public health mitigating things you can do without necessarily throwing your social life away. But I think one of the real key things is just being honest with yourself and saying, we can do this. We need to back it off just a little bit, but we can still have fun if we are and be safe at the same time.
Great. So some students have voiced concerns that they're fearful of being tested for COVID due to shame or embarrassment or fear as being named of an outbreak. Can you speak to why students should never feel ashamed or fearful regarding this?
Yeah, and I understand the emotion. I've been doctoring for a very long time, and when a new disease comes onto into our lives, then it's like I'm snake bit. I did something wrong. Somebody will think badly of me. And face it, this is not a sexually transmitted disease. It's not something that you've brought upon yourself deliberately. That said, you have to do the things to avoid getting it, and you want to know if you have it or if you might have acquired it from somebody, because you don't want to give it to anybody. You're going to eventually be going back to visiting your family members, older people who are at risk. And, I just think it's the reality of it, saying this is a part of living, is to have this pandemic. We haven't seen anything like it. And the way we're going to put a lid on this thing is to find it and then pull people back out of action that have it, and with the idea of driving it down completely. And I think it's well within your grasp to do that. I would not look at it from a pessimistic point of view. You and your colleagues can do this.
Great. So another question we have for you is, are you surprised by the increases in cases in college communities, not only in Kansas, but across the country?
No, I am. There's been nothing about this that has surprised me. And you can look, and I imagine you have looked at different college campuses around the United States and actually globally. And a great example is University of North Carolina. They announced in May that they were going to start in the fall or late summer, actually, with rather normal educational activities with some modifications, but not much. And then had to call off classes after just 1 week. That's how rampant the spread was. And that's absolutely predictable. And we are right now and on the cusp. We've had a bump in the number of cases, then it dropped down a little bit, has gone up and is leveled off now. You know what's going to happen is it's going to go up in strikingly in the fall and winter. So that is my prediction, and I want us collectively to say, what is it we can do to not have that marked increase in the number of cases? There's been nothing about college campuses that have surprised me at all.
So you mentioned the fall and the winter. So can you talk a little bit about your advice for the upcoming cold and flu season?
Yeah, really good question. A couple of things, and you mentioned the flu. It's really important that people realize this is not influenza. Influenza is a bad disease. It's been around forever. This is completely different than influenza in the sense, the only thing they're similar is that they're both viruses. But we don't have a vaccine for this. We do have a vaccine for influenza. Everybody really should get their influenza vaccination. They should probably get it, really from now until the first or second week of October. I think is a good way to get the influenza vaccine, because you don't want to, there's going to be a lot of COVID-19 and you don't want to confuse the two, and you want to prevent the influenza. And by the way, 1918, the Spanish flu, you read about that 102 years ago. We still have Spanish flu that circulates. It's one of the circulating viruses, one of the circulating flu viruses that's still out there. Why don't we have the Spanish flu anymore? And the reason is vaccination, which brings, of course, the consideration about COVID-19, the vaccination that's hopefully not too much in the distance. So yes, we will have people moving more indoors. You'll have people gathering tighter when they're outdoors. You'll be in old buildings that have kind of crappy air handling systems that don't move the air out very well. So everything about fall and winter makes it more likely that you're going to get a respiratory illness.
So speaking of vaccinations, can you give us the latest information on the COVID-19 vaccine and who should get it when it does become available?
Yeah. It's been, and I'm sure you've read the newspapers and heard radio and television descriptions of this. You don't know who to believe anymore, quite honestly, about when the vaccine is going to be here. I do know some things, though, and that is one, there's some leaders in this, the Oxford AstraZeneca people that are farthest down the road on the testing. They paused it because of one case they had concerns about, but the testing is still going on in phase 3. There's going to be a number of vaccines that will become available. I hear everything from experts to it'll be middle of 2021. I hear others that talk about it being here in November, December. I actually think we're going to have a vaccine before the end of the year. You asked a really important question, and that's about prioritization. Who's going to get it? We don't know that for sure. It's going to be very controlled by the Department of Health and Human Services of the federal government. And I think it's going to be fairly prescriptive. I suspect that it's going to be frontline healthcare workers, first responders, those that have medical illnesses or are elderly, like in skilled nursing homes, that kind of thing. And then I don't know that necessarily college kids will be top of the list. Military and military recruits will probably be high on the list. So I predict that college students, despite the fact you're an increased risk group because of your congregate living, you're living in close approximation, you're at higher risk, but from an immunological perspective, you guys are basically healthy. Some have other things that will put them on the list of chronic illnesses, but that's a fairly small population. So I would not hold my breath in necessarily being the first tier. And I don't know that that's necessarily a bad thing, Natalie, because that way you can keep an eye out there and figure out how's the vaccine working out. Are people getting, are there any untoward side effects? By not being the first one, you'll get to watch how well or how poorly is it working. I'm optimistic about the vaccine, and I'm optimistic before the end of the calendar year.
Great. Yeah, that's some really good advice and information. So another question that we have for you is, what discussions are currently taking place about mental health challenges that many are facing as a result of loneliness and isolation and other effects as of a result of the pandemic?
Yeah, that's another good question. Well, one thing I don't think you probably know, I was a social worker and I worked in a mental health center before I went to medical school. So not normal training for somebody that goes to become a physician, but, and needless to say, I've always been a social worker at heart. And I'm very cognizant of the fact that, as you point out, when people are have stay-at-home orders and school isn't in session, and I'm talking about everything from middle schoolers on up through adulthood even, people are at higher risk for suicide, self-harm, depression, anxiety, and I think a couple things are really important. One is to ask for help. And I know that sounds pretty obvious, but there's lots of helplines out there. Your student health center is very tuned into this. The second thing, and this is something that I think we all have as an obligation for ourselves personally, and that is keep an eye on your buddies. Keep an eye on your friends. You know, I'm in the military, and we call our friends and colleagues battle buddies. You know, we're in this war against COVID-19, we're all battle buddies together. So with your work colleagues, with your friends, your family, when you say, how you doing? Because they don't look so good, and they say, oh, I'm fine. Then you have to say, no, I'm serious. I really want to know how you're doing. I know you say you're doing fine, but I want to really understand if you're doing fine or not. Because a lot of times you'd be surprised somebody will say, you know what, I'm not fine, and let me tell you why. And then that opens the door for asking for help for counseling or but the first step is to recognize when something's going on, and then it makes it a lot easier. So keep an eye out for it and work with your battle buddies.
Great, thank you. That is really great advice. And I think that's actually all the time that we have today, unless you have anything else you'd like to add or anything you want to talk about.
No, I think I have one thing, and I touched on it just briefly, Natalie, and that is I think it's really helpful to not work in isolation. If you and your fellow students and student leaders are interested in it, get your university administration, somebody from town, because every university is in a town or a city, and get a little broader coalition of people say, how can we fix this in this community? Because I know the bars and restaurants are always under criticism for being places where the disease spreads, and it does spread it. So they need to start limiting how they operate their businesses. But you can't make that happen as just one Natalie. You know, you've got to have a broader coalition. So and encourage your community leaders and mayor and those kind of folks to work with you, and that's really important. So we're in this together, and I think that's really important to remember.
Yeah, thank you so much. Thank you for spending time with us today. We really appreciate all of your advice and your insight. So thank you so much.
Okay, Natalie, have a good school year.
You too. Thanks, guys. Thanks for tuning in.